Hi everyone, it's Mike from NewJerseyInsurancePlans.com. Today I'm going to go over how you can save considerable amount of money on your health insurance using healthcare.gov. A lot of people also call it Obamacare. Now before I start, when I usually bring this up, a lot of people say, hey Mike, I don't want Obamacare. Nobody takes the insurance. It's no good. All kinds of different things like that. The truth of the matter is, the plans on the exchange, the healthcare.gov plans, they are identical in every single way to a plan you were to buy direct with Horizon Blue Cross or Amerihealth or whatever carrier it may be. The plans are exactly the same. What is different is how much you pay for those plans. So if you qualify for a subsidy, the tax credit, you can purchase the same plan for a lot less money. So today I'm going to go over how that will work and on how you can start to figure out if you qualify or not. So one of the big things people look at, they say, hey, I make too much money. I made over the threshold last year, so I don't get a credit, so I'm not even going to try. So I suggest you do try and at least see if you can do it. So the case I have here, I'm on probably my favorite site for the individual health. It's called healthsherpa.com. So I just use a zip code in Absecon 08201. I have a single person, and this person's income is $56,000. So the cutoff for healthcare.gov for the exchange of credit is somewhere around 48,000, somewhere in that range, where they begin to become phased out for the credit. So in this case, I agree with them. You first look at it and say, yeah, you know what? You probably don't qualify. You make too much money. So I put the 56,000 in here, and just to give you an idea of what the premiums look like. So the plan we'll focus on is this Horizon Blue Cross Omnia Bronze HSA, $809 a month. Wow, that's a lot. So let's just see if we can find a way to actually get this gentleman to qualify for a subsidy, or see if maybe he just qualifies already doing what he's doing. So over here I have the poverty limits that they use to calculate the subsidies. So as long as you stay under the 400% level, you do qualify for a tax credit. So in this case, we have a single gentleman. So the most he can make is $48,000, $48,240. So as you remember, I put an income of $56,000. That was his gross income. So the credit, this 400%, it's based on your modified adjusted gross income. So if you've ever looked at your IRS, your 1040, your tax return, down the bottom right corner, you'll see adjusted gross income. That's the number they're going to use. So if we look at here, this gentleman, $56,000 of gross income. You automatically get your personal exemption, which is $4,050 per head in the household. It's a single person, so we reduce his income from 56 down to around 52. Now, he was also contributing to a 401k at work, and he was putting in $3,600 a year. So that further reduces his income. So now we're getting even lower. And then he says, you know what, if I have some health expenses, I wouldn't mind using the HSA account. I'll save a little bit more on taxes. Sure, I'll go ahead and do it. I think I can do maybe $2,000 a year. So we started with 56, lowered it by 4, and then another 36 for the 401k, and then another 2,000 for his health savings account. So now instead of 56,000, the income for the purpose of the exchange will be 46,350. Okay, so now he's below this threshold. So let's see if it was worth it. Let's see if you can actually get the credit and how much it would be. So I'll go back to healthsherpa.com. I'm going to edit his information. And what I say, 46. So we'll update his income and recalculate. Wow. So for this gentleman, if he does exactly what we had on there, his premium would be reduced by $502 per month. That's very significant. That's almost $6,000 a year. All just for applying on the exchange and buying the exact same plan he was considering buying direct to the carrier. So now that same plan, saying being $809, it's $308. So that's it. That's all I wanted to show today. I just wanted to show how you can reduce your income by you can use a 401k, a traditional IRA, or even the health savings account if you purchase an HSA qualified plan to get your income down. And this works for families, 2 adults, parent, child. It doesn't really matter how you're set up. If you can squeeze yourself into one of these categories here and get under the threshold, it can make a huge difference in your tax return and reduce your premium. So I definitely suggest it to anyone who thinks they may be close or have the possibility of coming close to getting under this threshold. So again, it's Mike from NewJerseyInsurancePlans.com. If you have any questions, you can always contact me at mike@NewJerseyInsurancePlans.com. And I hope you have a good day. Thanks. Bye-bye.